Hello and welcome to LA Currents. I'm Saida Pagan. According to the U.S. Census Bureau, every day 10,000 Americans are turning 65 years of age. So the topic of mental aging is very relevant to all of us as more Americans grow older. As both the body and mind age, what does the latest research say about our chances of developing Alzheimer's disease? And what can we do to prevent or delay mental decline? Today, we are joined by two of the country's leading researchers in this field. Dr. John Ringman, a professor of clinical neurology at the Keck School of Medicine at the University of Southern California, and Dr. Elizabeth Joe, who is an assistant professor of clinical neurology also at USC. Thank you both for joining us.
Thanks for having us.
Now, we know that both of you work at the Alzheimer's Disease Research Center. Tell us a little bit about this center. Let's begin with Dr. Ringman.
Sure. So back in the 80s, the National Institutes of Health identified aging as a significant issue and then established a network of centers funded with taxpayer money to study Alzheimer's disease and cognitive aging and aging in general. So the USC was one of the first centers funded at that time, and we've been continued to be an Alzheimer's disease research center since then.
Wonderful. Now, I would like to get information from both of you here. What actually happens to the human brain as it ages? Let's begin now with Dr. Joe.
So there's a number of changes that happen with getting older that happen to everybody. So everybody starts to have a little bit of trouble with finding the right words, a little bit more of the situation where you walk into another room and you can't remember why you went in there. So those are changes that are normal with aging that happen to everybody. Then getting older also puts you at an increased risk of developing diseases that are associated with aging, such as dementia and Alzheimer's disease and other things along those lines.
And Dr. Ringman, what is actually happening to the brain? We mentioned some symptoms, but what's actually happening to the brain as we age?
Sure. With normal aging, whatever that is, because everybody's different, but with normal, so-called normal aging, there is a slowing down of how the neurons, those cells where the calculation is done, if you would, the speed at which they can communicate, but also overall you tend to lose those cells with age. So there is a overall shrinkage of the brain that occurs, especially in more advanced age. Luckily, there is some compensation that can occur, and that the way that cells are connected to each other can change with our experience.
Now, a lot of us in the public are a little confused about the difference between dementia and Alzheimer's. So both of you, I'd like to throw it out to both of you to explain the difference to our audience.
Sure. So dementia is just a general term that refers to a cognitive problem that affects your ability to do your everyday activities, like managing your money or remembering to take your medications. There's a lot of different causes of dementia, but the most common cause is something called Alzheimer's disease, which refers to a specific disease which is caused by the buildup of two proteins in the brain. One protein is called amyloid and one protein is called tau. And over time, as these proteins accumulate, they injure nerve cells, and that causes symptoms, which usually start first with short-term memory loss and over time progress to affect other parts of cognition and ultimately your ability to take care of yourself.
Now, we want to talk specifically today about Alzheimer's research, but Doctor, what are some of the other causes of dementia in addition to Alzheimer's?
Sure. So Alzheimer's disease probably accounts for about 2/3 of cases of dementia in the elderly. Other relatively common causes are cognitive impairment, dementia due to cerebrovascular disease, that is, having had strokes. But also the Lewy body disease or Lewy body dementia is another cause. That's it's on a spectrum with Parkinson's disease, but there are many other causes. Frontotemporal dementia is another neurodegenerative cause of dementia, which is less common. But all things down to have head injury, like having been hit in the head too many times, or one time severely. But also, there are things that are more tractable, more treatable, like vitamin deficiency and things like that. So it's our job to figure out, to identify those and treat them as appropriate.
Now, I think a lot of people are wondering, well, when is it going to start happening? So let's talk about the age. I know it can happen at a very early age. Doctor?
Right. So, that again, the changes that are typical with normal aging start to happen gradually, starting kind of in midlife and continue as you get older. Your risk for developing Alzheimer's disease goes up significantly, even especially as somewhat after you cross 65 and significantly after you hit about 80 or 85. So the risk for someone who's between 65 and 75 of developing Alzheimer's disease is about 1 in 250, but the risk of someone who's over 85 of developing Alzheimer's disease in the next year is about 1 in 13. So the risk really goes up a lot. There are rare forms of Alzheimer's disease that Dr. Ringman studies that can present a lot earlier in the 40s or even earlier than that.
Would you like to add to that?
Well, sure. Well, luckily, that kind of form of Alzheimer's is very rare. But we've been studying a number of families that are basically our one extended family that have onset around age 40. But just this morning I was seeing a patient that started getting symptoms at age 23. But like I say, it's luckily a very rare form of Alzheimer's disease.
I guess all of us are wondering also, well, can we delay it? Can we postpone this? Even if, we want to live a long time, but we want to live a happy life and a life where we're alert and we understand what's going on. So we're going to get into your research, but in general, does it tend to be genetic factors or environmental factors? And I'd like to open it up to both of you. Dr. Joe?
So good question, and there's some of both. So the young onset Alzheimer's that Dr. Ringman mentioned is essentially exclusively genetic. For older adults, there is a major genetic risk factor. The ApoE gene, one particular version of it, ApoE4, is the most common genetic risk factor for Alzheimer's disease. And it's something that's common in the population, and if you don't have if you do have this gene that puts you at higher risk, it doesn't mean that you will develop Alzheimer's disease 100%, but it does increase your risk significantly. So about half of all people with Alzheimer's disease have the risky gene, the ApoE4 variant. At the same time, we do think there's a lot of environmental factors as well, or not environmental so much as lifestyle. So we think that the risk factors that contribute to heart disease also contribute to brain disease. So things like high blood pressure and diabetes, we know that they can cause memory problems and dementia. We're trying to find out at USC whether they cause Alzheimer's disease in particular.
Would you like to add to that, Dr. Ringman?
No, I think that's well said.
Yes.
I would just say that in general, the younger onset forms, even separate from the kind that I study that are clearly genetic, but in general, the younger the onset of the disease, the more genetically driven it probably is. So we think that all these things that we could do in the environment to optimize brain health are really going to have more of an impact on those people who would develop Alzheimer's later in life, or even potentially delay it and prevent them from getting Alzheimer's later in life.
Well, let's talk about the research that you are doing, Dr. Ringman. You are looking at the Latino or Latinx population. So give us some background about why you started this and where it's going.
Started seeing families with a form of Alzheimer's disease that starts around age 40. So I saw one patient that had this, and I realized the patient had a parent that had it, some of her siblings had the disease, all beginning around age 40. And around that time, the genes that had caused this form of Alzheimer's had been recently identified. Interestingly, this family came originally from Guadalajara in Jalisco State in Mexico, and then we subsequently saw more families, now 90 different families, all of whom have this same genetic alteration. We know this is now what we refer to as a founder effect. That is, all these families are distantly related they've all descended from one person that had this illness. So that got me interested in studying this, because when you have a genetic alteration like this that it's what we call fully penetrant, that means determinant, that if you have this genetic alteration, you will develop the disease. Not a risk factor, unfortunately. But by identifying people who had these genetic alterations that didn't yet have symptoms, we could study what was going on in the years prior to even developing symptoms. So understanding what changes that are occurring in the brain and how to measure them. We're focusing on studying that, but also finding out how that is similar and different from the more common late onset form of the disease.
Are they perhaps families that have roots in other countries, or primarily from Mexico, going back numerous generations?
So the bulk of the families that I'm studying are from this common founder in Jalisco State in Mexico. So many of them, well, some of them have been here for a few generations, others just for one generation.
So you're studying families that reside in Mexico and reside in the United States?
Yes, yes.
And how far back does this go? Were you able to find out how many generations back it began?
Right, that's a good question, and no, that's hard work to do. The area and the group that it seems to have come up in is quite a mix. They're quite a mestizo mix with a lot of European blood.
And so tell us a little bit more about what you found. I understand you're studying this population, and what are some of the other details? Give us some details of what you've been able to determine from having studied these individuals.
We've identified, for example, there are changes, chemical changes in the cerebrospinal fluid, so that is the fluid that bathes the brain and spinal cord, that we can identify chemical changes characteristic of the illness that are occurring 15 to 20 years before people get overt dementia. So it's something we can identify what's happening really early on. Also, we've measured inflammatory markers and other things that give us clues as to what is actually driving the disease. And by identifying these markers, it give us targets for potential treatment.
Now, Dr. Ringman, we were talking about the Latino community and the fact that you're doing research there, and you identified, was it 90 members of the family?
90 different families.
So how many members?
Too numerous to count.
Okay.
Yes.
In the thousands?
Well, yes, but I haven't seen all these individuals, of course.
Right.
I mean, whenever I talk to people, they tell me about their family, and not everybody, luckily, not everybody turns out for the research, or I wouldn't be able to be here today.
Right. So tell us about the outcomes. What about the lifespan of these individuals?
So unfortunately, the age of onset of Alzheimer's seems to really be an index of how aggressive the disease is. So unfortunately, these folks that get it at a young onset, the progression tends to be more rapid. So we've seen people, it can vary, people can go from, once they have overt dementia, that it can be 6 years, it can be 10 years. Whereas in late onset Alzheimer's, I've seen people survive 20 years after the diagnosis. So it's clearly a more aggressive form of the disease.
We're going to come back to that and maybe put a face on it, no names, but a face on what you're discussing with these individuals. But let's talk now to Dr. Joe about your research, which has to do with the vascular.
Right. So I work with USC's primary cohort study. So we are enrolling older adults who either have no memory problems or mild memory problems, and then we're following them over time. And our hope is that, similar to Dr. Ringman, who follows people that he knows will develop Alzheimer's, that the participants that we follow, percentage of them will go on to develop memory disorders and Alzheimer's disease, and we'll be able to get a sense of what the very early changes have been.
I'd like to get into what your research has revealed. Tell us what you're doing and what is your hypothesis?
So we are asking people to do multiple different types of procedures. So we have them do a special MRI scan that lets us look at the blood-brain barrier, and also a sample of spinal fluid to look at. We have some special markers that also let us assess the health of the blood-brain barrier. So our hypothesis is that very early changes may be driven by breakdown of the blood-brain barrier, which is what keeps the brain and the spinal cord separate from the rest of the body to protect it from infection. And we think that may be damaged early on and maybe contributing to the buildup of the proteins.
And do you have any preliminary research at this point?
So it does look like the blood-brain barrier changes are seen early. We're still following people, so we'll have to see how they go on to do over time. But it does look like it is an early change, especially in people that have the genetic risk factor for Alzheimer's, the ApoE4 gene.
And is this type of research that you're doing being conducted in other parts of the country?
Yes, absolutely. So almost all of the Alzheimer's disease research centers that are funded by the NIH follow older adults over time. They all have different focuses, though. So at USC, our interest is specifically in the health of the vascular system and how that contributes. So that's a little different than a lot of the other centers, so who may be looking at other specific changes.
Okay, but again, so what are you finding? That there is definitely a correlation?
So we do think that, so we are still, getting our preliminary data, which we're hoping to be published soon, but it does look like the health of the blood-brain barrier is affected early in people with a genetic risk factor for Alzheimer's.
And are you able to give me, of course, no names, but an example of someone who may have one of these other diseases, diabetes or whatever else, who's also experiencing symptoms related to Alzheimer's?
Yeah, so we do see that it's really common for people to have multiple problems. So we know that diabetes directly can cause cognitive changes through the impact on blood vessels, vascular cognitive impairment or vascular dementia. It's also common for people to have vascular dementia and Alzheimer's changes at the same time. And so people can definitely have multiple problems, and especially with the oldest adults over 85, it's very, very common to have multiple types of pathology in the brain, which it's hard to sort out sometimes which one may be contributing the most to their memory symptoms.
Can you tell me about somebody? Without, of course, revealing their identity or anything about them in general, a woman, a man, a child, whoever you might have met. Are there any examples?
I can think of an older gentleman who does have diabetes, and he's had maybe a little bit of cognitive symptoms for some time, some mild memory symptoms. I think he's about 80. But over the past couple of years now, the memory symptoms have gotten much more pronounced, and so the question we have talking to him, he's starting to repeat himself a lot more in conversation, is it still just the vascular cognitive impairment that we thought previously, or is he also now developing Alzheimer's disease?
And Dr. Ringman, what about these people, 90 families? Do you have an example of someone that you've talked to? How do they feel about this?
Sure.
Tell us about that.
Sure. I think the person that I've grown to know the best is the daughter of the patient I originally saw. The first patient I saw with this form of Alzheimer's, I've known her since, now it's been 20 years. She was in her early 20s when I first met her. And, I cared for her mother and, identified that she herself was at 50% risk of inheriting this from her mother. And I've been there her whole path. Her path has run from her participating in our research studies to ultimately participating in a clinical trial, a study to prevent the disease in people who have this, are at risk for these genes that will ultimately develop the disease. Unfortunately, just yesterday, the results came out from that study, at least the preliminary results indicating that the intervention was not effective. So as somebody was telling me this, I looked down and my cell phone was ringing, and there was her number. So she was calling me like, what do I do now? So that was a very personal story. She's a good friend of mine.
Yes, definitely. So that leads us to the question, what can we do to perhaps either prevent it if it's not genetic, or then what can we do to perhaps delay it?
We think that everything that's good for the heart is good for the brain as well. So we encourage everybody to exercise. We think aerobic exercise is really, really important. It helps get your blood pumping and helps your brain get enough the blood that it needs. We also think that a generally healthy diet, in particular a Mediterranean-style diet, has evidence for preventing or slowing cognitive symptoms, and including lots of fruits and vegetables, a variety rich in antioxidants, and also eating fish we think is helpful, get the omega-3s. And then taking care of the same risk factors that can cause heart disease. So if you have high blood pressure, making sure you're working with your primary care doctor to have it well controlled. If you have diabetes, same thing, working with your primary care doctor to make sure it's really, really under good control.
Would you like to add to that?
No, I think that's well said. We should definitely probably all eat more fish. I think exercise is the best evidence for what can improve people's well-being overall, but specifically help them sleep better, improve their mood, and also make them sharper. Aerobic exercise, running, swimming, whatever it is you like to do.
Now, going back to your research, are you looking for people who are willing to participate? Tell us about that, Doctor.
By all means, we're always looking for folks to participate in our studies. Without participants, we can't make our scientific observations. We have very specific studies, right? So we might not have a study for everyone, but there are people who are really basically healthy people who are concerned, are frequently for many of our studies, participants are people who are healthy of a certain age and are concerned about their risk of developing Alzheimer's because they had a family member that had it. So whether it's a highly genetic form or a late onset form, that's tends to drive a lot of our studies and enrollment therein.
You mentioned earlier about possible medication, cure. How far away are we from all of that?
Cure is a strong word,
yes,
right?
Okay,
so cure implies
you're
completely, someone who's affected by illness, you're reversing it and they're normal. That may be tough to do in Alzheimer's because by the time people show symptoms, they've lost a lot of their brain, and their parts of it. So actually returning someone to normal who already has dramatic symptoms may be a tough goal. But more tractable is slowing the progression or preventing it, putting it off what would be the onset in people by 3 years, and people, if they're older in life, that may have a big impact. I think we're pretty close to that. Unfortunately though, if you'd asked me this 20 years ago, I would have told you the same thing. So we'll see. I think we're on the right track. I think because of some recent drug study failures, I think we're opening up our mind as to what avenues to pursue, and I think that that's gonna, in the long run, is gonna lead to treatments or preventive measurements, which may be combined treatments. There may not be one thing we can do to prevent Alzheimer's, but we may have to engage in a combination of things.
This is a fascinating subject, and I'm sure a lot of our viewers want to find out more. So where can they start with their research, Dr. Joe?
So if they're interested in learning more about Alzheimer's disease, a good place to start is any website published by the National Institutes of Health or the NIA. They have a lot of resources online. If they're interested in participating in clinical research, they can either go to clinicaltrials.gov to look at options for different trials that they might be eligible for, or they can go to the USC ADRC website, which is adrc.usc.edu, and we have a list of all of our currently enrolling studies, and they can see what they might be interested in.
Do they have to be careful about what they read? I'm sure there are a lot of conflicting sources of information out there.
Yes, we be very careful, especially what you see on TV. Yeah. Because people were advertised to sell on TV, because people will sell things to people who are desperate, and at what cost. So we get a lot of questions in clinic about things that people have seen on TV.
In general, any website that's put out by the government or the Alzheimer's Association is another place that has really good resources for everybody to look at. those are a little bit more reliable.
Now, I have a question for both of you. You work closely with the National Institute of Aging and the National Institutes of Health. So let's begin with Dr. Ringman. Tell us about your mission as it connects with these different agencies.
Sure. The National Institutes of Health is our primary source of funding for the work we do. They pay for the Alzheimer's Disease Research Center. And within the National Institutes of Health are various subdivisions, including the National Institute on Aging, which is a specific subsection of the NIH, which funds the Alzheimer's centers. But also I have some grants from them that are separate from the center grant. But also the National Institute of Neurological Disease and Stroke can fund some of this related work. So the National Institute of Health is a big umbrella that funds a lot of this. This is your taxpayer money at work. However, we also can receive funds from, depending on the study, if it's a drug study from a drug company or from private foundations. The Alzheimer's Association provides money for research, a lot of which is raised by donors and people who go out and do walks for the cause.
How long do you have funding for? How many years looking forward?
It's likely, it's a 5-year cycle, so you get funded in 5-year cycles, and it looks like we're probably just got funded, or going to be, knock wood, for another 5 years starting in April.
So until 2025?
Yes.
Approximately?
Approximately.
and that's a good thing, definitely. Well, thank you both for joining us for this edition of LA Currents, and good luck with the wonderful research that you're doing. And thank you for joining us for this edition of LA Currents. I'm Saida Pagan.